So we've got a lot of viewers that are turning 65. What are some of the big questions about Medicare they should be asking?
Oh, good question. Well, number one, they should be asking, do I need Medicare? Just because I'm turning 65 doesn't necessarily mean I need Medicare. Now, what I mean by that is if you're employed and have group health insurance, or your spouse is employed and has group health insurance and they're planning on continuing working, you don't necessarily need Medicare. Now, whether it's better coverage or not, that's a different story. But technically, if there's more than 20 employees, you don't need Medicare. Now, if you're not in that boat, if you don't have any coverage, or you have coverage through the ACA under Penny, maybe you have a short-term plan, a Christian share plan, VA benefits, okay, you're going to need Medicare.
Okay. Great points. What else? What other questions?
So the next is they should be asking themselves, do I want a Medicare supplement with a standalone prescription drug plan or a Medicare Advantage plan? Medicare isn't going to cover everything. They're not going to financially cover all your bills. Right. All right, a lot of times they'll only cover 80% for certain services. Other services, they leave a larger deductible behind. So you really got to consider, which path do you want to take?
Is there anything else they should be asking?
Yeah, so if they end up, regardless of what plan they go to, they want to find out, is my doctor going to take coverage? That's what's really important to a lot of our clients. I want to make sure I could go see my doctor. Okay, well, if you have original Medicare and a supplement, the original Medicare goes anywhere pretty much. Your doctor's going to take it. If you have a Medicare Advantage plan, do you have a PPO or an HMO? That's going to kind of dictate, do I have to stay in network? Can I go out of network? What are the price differences? With that. So finding out, making sure doctors in network, that's stuff that we do for our clients every day.
Nobody wants to lose their doctor.
No.
That's a lot to consider, Mike. If someone wants help, what should they do?
Well, a lot of people are out there. I'm going to ask them a question. How would you feel if this process was taken care of and made simple? Well, that's what we do. We do that for clients every day. We do it at no cost for them. We're compensated the same from the insurance carriers. We're licensed with all the insurance carriers. What we do is collect information from you, find out what prescription drugs you take, if any, what doctors you see. That way, we'll do the research. We'll share those options with you when we meet, either in person or by phone. You don't have to be local. All right, we're one of the top agencies in all of Pennsylvania and New Jersey. We cover a lot of other states as well. So the best thing to do would be to give us a call, send us a text, send an email to us.
All right, Mike, as always, thank you for joining us on Community Connection.
Thank you, Liz.